What is osteoarthritis? Osteoarthritis, OA, is the most common chronic joint condition. OA is also called wear and tear arthritis, degenerative arthritis, and degenerative joint disease. A joint is where two bones come together. Cartilage is the protective tissue that covers the ends of the bones. With OA, this cartilage breaks down, causing the bones within the joint to rub together. This can cause pain, stiffness, and other symptoms. OA can occur in any joint. However, the most commonly affected areas of the body include the hands, fingers, shoulder, spine, typically at the neck or lower back, hips, knees. OA occurs most often in older people, although it can occur in adults of any age. OA is a leading cause of disability. The Centers for Disease Control and Prevention, CDC, trusted source says that it affects more than 32.5 million adults in the United States. Here's everything you need to know about OA, from treatment to prevention and more. Osteoarthritis symptoms. The most common symptoms of OA include joint pain, stiffness in the joint, loss of flexibility and reduced range of motion, tenderness or discomfort when pressing on the affected areas with your fingers, inflammation, crepitus or grating, crackling, clicking, or popping sounds when you move your joints, bone spurs or extra lumps of bone, which are typically painless. As OA becomes more advanced, the pain associated with it may become more intense. Over time, swelling in the joint and surrounding area may also occur. Learn how to recognize the early symptoms of OA, which can help you to better manage the condition. Osteoarthritis causes. OA is caused by joint damage. This damage can have a cumulative effect over time, which is why age is one of the main causes of the joint damage leading to OA. The older you are, the more repetitive stress you've had on your joints. Other causes of joint damage include past injury, such as torn cartilage, dislocated joints, or ligament injuries, joint malformation, obesity, poor posture. Certain risk factors increase your chances of developing OA. They include having family with the condition, particularly parents or siblings, gender, with women having higher rates of OA than men, being at least 50 years old, according to the Arthritis Foundation, having undergone menopause, having an occupation that involves kneeling, climbing, heavy lifting, or similar actions, a history of injury, being overweight or having obesity, poor posture, having another medical condition that affects your joint health, such as diabetes or a different type of arthritis. Having OA in one part of your body also increases your risk of developing OA in other parts of your body. Osteoarthritis treatment is CMOS. CMOS is the answer. Order from www.veganchoicefoods.com or click the link below this video. CMOS is rich in omega-3, calcium, magnesium and vitamin K, which help to support maintaining healthy joints and bones. According to many studies, daily collagen supplements help make your bones denser, reducing the aging process that causes them to become fragile and helping your body in producing new bone. CMOS is high in proteins that help the body to build collagen. Is Irish moss good for bones? Irish moss and other seaweeds can provide important health benefits. For example, seaweed is rich in iodine, which is an important nutrient for your thyroid. Iodine helps your thyroid produce hormones that control your metabolism, nerves, and bone growth. Eases joint pain. The combination of antioxidant and anti-inflammatory properties naturally found in sea moss provide an effective remedy for joint pain. Joint pain relief by sea moss is thanks to potassium iodide and potassium bromide, which are natural components of moss plants. Weight management. Being overweight can put strain on your joints and cause pain. Shedding some pounds helps relieve this pressure and reduces pain. A moderate weight can also lower your risk of other health problems, such as diabetes and heart disease. Adequate sleep. Resting your muscles can lower swelling and inflammation. Be kind to yourself and don't overdo it. Getting enough sleep at night can also help you manage pain more effectively. Heat and cold therapy. You can experiment with heat or cold therapy to relieve muscle pain and stiffness. Apply a hot or cold compress to sore joints for 15 to 20 minutes, several times per day. Exercise. Physical activity strengthens the muscles around your joints and may help relieve stiffness. Aim for at least 20 to 30 minutes of physical movement, at least every other day. Choose gentle, low-impact activities, such as walking or swimming. Tai Chi and yoga can also improve joint flexibility and help with pain management. The bottom line on treatment. These practices can help take the edge off of your symptoms and improve your quality of life. Check out this full list of OA treatments. Complications of osteoarthritis. It's well known that arthritis, including OA, can cause physical complications. OA can cause emotional complications too. Physical complications include poor sleep, weight gain as a result of pain or limited mobility, osteonecrosis or bone death, erosion of the ligaments and tendons, hairline, stress, fractures, hemarthrosis or bleeding near the joints. Emotional complications include anxiety and depression brought on by the loss of function. Severe osteoarthritis. OA is a progressive condition with 5 stages from 0 to 4. The first stage, 0, represents a typical joint. Stage 4 represents severe OA. Not everyone who has OA will progress all the way to stage 4. The condition often stabilizes long before reaching this stage. People with severe OA have extensive or complete loss of cartilage in one or more joints. The bone-on-bone friction associated with this can cause severe symptoms such as increased swelling and inflammation. The amount of synovial fluid within the joint may increase. Normally, this fluid helps reduce friction during movement. However, in larger amounts, it can cause joint swelling. Fragments of broken-off cartilage may also float within the synovial fluid, increasing pain and swelling. Increased pain. You may feel pain during activities and also when you're at rest. You may feel an increase in your pain level as the day progresses, or more swelling in your joints if you've used them a lot throughout the day. Decreased range of motion. Due to stiffness or pain in your joints, you may not be able to move as well. This can make it harder to enjoy the day-to-day activities that used to come easily. Joint instability. Your joints may become less stable. For instance, if you have severe OA in your knees, you may experience locking, sudden lack of movement, or buckling when your knee gives out. Buckling can cause falls and injury. Other symptoms. As a joint continues to wear down, muscle weakness, bone spurs, and joint deformity may also occur. The joint damage caused by severe OA can be treated with consuming sea moss every day while taking Dr. Sebi approved herbs. Visit www.veganchoicefoods.com or click the link in the Buy Zero.